and he did his med school at OSU. Oh,
Recording. Go ahead.
okay. And his residency in Boise, and hopped right back over the mountains to us here. Been here for 5 years and been relatively quiet until what? How many months ago, Geoff?
Oh gosh, are you talking about with our current coronavirus situation?
Yeah.
Yeah.
Anyway,
Yeah.
I'm just going to let you take it. And please, folks, put questions in the chat box. We'll try to get at those things. Dr. Maly's going to give us an update of where he is, where the clinic is right now with healthcare, with COVID, with other issues that get involved with that. And we'll go from there. Go ahead.
All right. Sounds great. Rich, thanks so much for the introduction. And thanks all for joining, and thanks for your patience while we sorted out some technical problems. So I was hoping I would be able to share my screen with you and show you some of the slides I'm looking at, but I'm on my phone, so we'll have to just refer to those, and hopefully you guys can take a look at those later. But yeah, so and Rich, thanks so much for having me on as well. So as Rich said, yeah, I'm a family physician here at Winding Waters Clinic. I'm the medical director here, and have been in Wallowa County for 5 years. And my wife is also a physician here, and have a family here as well. So we've felt very fortunate and fortunate to be here. And yeah, I also work at the hospital. I work in the emergency department. I admit patients to the hospital as well. So I have been over there, in fact, taking care of a patient with coronavirus there this morning. So sort of unfortunately intimately familiar with the coronavirus, both on an outpatient testing and clinic standpoint, and also in the hospital. So so yeah, really happy to join you and share the information that hopefully will be helpful to y'all. I think my goal today would be to hopefully give you guys a brief update on the coronavirus sort of case rate and vaccination rate and other things here in the county currently. And then, yeah, would love to answer any questions. I guess I'll say I really appreciate you all logging in and listening to me. I know there's lots of information to be had on from lots of different sources, and some of it is more helpful than others. And so I just really appreciate that you all are logging in to listen to me. I'm hopeful that my goal is to help Wallowa County stay as healthy as possible, keep as many people out of the hospital as possible, and help us all get through this. Yeah, it's been a really challenging year and a half for us in healthcare, as well as I'm sure all of you. And I think especially a trying last about 6 weeks has been especially acutely challenging for all of us. So. So that's the goal for I guess the next 45 minutes or so. I was looking at data this morning. So I think just about cases and case rates and vaccination rates and things, and maybe you guys are familiar with this already, but probably a couple of resources I use to look at those. Or the Oregon Health Authority keeps excellent website on case numbers and case rates, which would encourage everybody to look at. That does sometimes lag behind a bit from what's happening here, sometimes by a few days, sometimes up to a week, especially when there are fatalities from COVID-19. So bear that in mind. Those numbers are sometimes not, do lag behind several days. So, but that is probably the best website, and I get their updates. I'm signed up for their email updates to get those every day, so that I get a good idea of what's going on here, but what's also going on in the rest of the state, which really does affect us here, especially when we're trying to transfer patients to surrounding hospitals and there's no hospitals to send people to. So Yeah, right now I was talking with our folks who do our contact tracing and case investigation. We have 50 active cases in the county currently. So these are patients who've been diagnosed and within the 10 days of from their positive test. So they're in the isolation period. So we have, so that's 50 active cases. We've had, this is really our biggest case though that we've had by far during the pandemic here in Wallowa County. We were fortunate to be fairly spared of high numbers earlier in the pandemic, but with the Delta virus, Delta variant of the virus, that has unfortunately not spared us, as I'm sure many of you are aware. So, so that's our case, sort of our active case number. I think our percent positivity rate, which looks at testing and percentage of positive tests, which gives us some idea of how much virus is circulating in the community. I think our data this morning was 10% positivity rate. So, that's significantly higher than it had been. And that just tells us that, 10 people we test, one of those 10 is positive. And so it gives us some vague idea of this sort of burden of circulating virus. Let's see. As far as vaccination, I think the CDC and the NIH probably have the best. Well, actually, sorry, the Oregon Health Authority. Let me wind back. Oregon Health Authority does have keeps numbers on vaccination rates by county. I think our overall all adults fully vaccinated is I think around 51% now, a little bit below the state average, which I think is 60%. And that has been slowly improving. That does include children, so most of whom, under 12, especially, are not eligible for vaccination at this point. But compared to other rural counties in Oregon, Wallowa County does have a higher vaccination rate compared to other rural counties. So we've certainly been encouraging everybody to get vaccinated and trying to make it as available as possible to anybody who is willing to get vaccinated. The CDC and NIH also have great websites looking at guidelines for quarantine and for testing. Also, the NIH has the best guidelines for treatment for coronavirus. This has been especially important, and we've been turning to this a lot in the last 6 weeks as we've had to treat more people with coronavirus, especially in the hospital. Our current sort of best therapy for coronavirus for people who are high risk if they contract the disease and who are high risk for developing severe illness. There's a large sort of number of people who fall into that category, but basically anybody over 65, anybody with diabetes, some other chronic illnesses, anybody with a body mass index over 30, in some cases over 25. We're trying to get those people treated early with monoclonal antibody therapy. That has been shown to decrease risk of hospitalization by about 70%. So people who get sick, get diagnosed with coronavirus, have a mild disease, so have some symptoms, but are not needing oxygen. We're trying to get those people treated with monoclonal antibody therapy. It is pretty resource intense. We need to put an IV in, have a nurse administer the medicine, watch people for an hour. So sometimes that creates some challenges, but we've really been trying to do that in various settings to get people treated and keep them out of the hospital and keep them from getting really sick. There are some therapies we give in the hospital. Dexamethasone and remdesivir are the two therapies that we're using in the hospital currently. Those can help, also help people. Those are mostly for people really only reserved for people who are in the hospital and on oxygen. That's pretty much our current sort of treatment guidelines for coronavirus. Let's see if there's any other topics, and looks like we've been having some things coming on the chat, which is excellent. Yeah, I think that's probably it. I think probably a question that will come up, and maybe it's already come up in the chat, is about booster doses or third doses, depending on sort of what the terminology you're using for the coronavirus. And we are currently only giving booster doses or third doses to people who have significant immunocompromising conditions, people who have cancer and on chemotherapy, people who have organ transplants, and some others limited cases. So that's only, I think, about I want to say it was 3% of the people that have been vaccinated, something like that. So it's a pretty small number, but hopefully we're getting those people vaccinated, and we're still waiting for guidelines from the Oregon Health Authority for when we can release third doses for people, and sort of what the time frame looks like. So we'll hopefully message that out when that's available. I expect that'll be later in September, maybe October. As you might have read in the popular media, the White House is sort of pushing the CDC to release the third doses earlier than, or sort of as soon as possible. And right now the CDC is not recommending that at this time, but I do expect that'll happen at some point this fall, and we'll certainly try to get the word out to everybody. I imagine we'll do some vaccination clinics again, similarly to what the hospital did previously, and what we had done here at the Winding Waters as well. And we're also, as healthcare.
There's a question there, Dr. Maly, about, of the current 50 cases, do you have an idea of how many are unvaccinated?
Sure, yeah, good question. I think that we have about a 10%, maybe 10 to 15% breakthrough cases. So of those 50, 10 to 15% are people who are vaccinated. So yeah, we have been seeing breakthrough cases, and people who are fully vaccinated, some people with immunocompromising conditions, and other people who do not have any other underlying other health issues. So so we are I think part of that is we're encouraging everybody to continue, even though even folks who are fully vaccinated, to continue to follow social distancing guidelines, wearing a mask, washing your hands, and being outside as much as possible, and not spending prolonged periods of time inside with people, even if everyone's vaccinated. And we're certainly trying to follow those guidelines here at our clinic. And and I think we're all, as healthcare workers, anxiously waiting a opportunity to vaccinate everybody here who's on the front lines and taking care of coronavirus patients every day, trying to keep us all safe as well. So we're still waiting to getting additional doses as well. So
a follow up on numbers. I know that the Oregon Health Authority lists people by county of residence. You have already said that our vaccination rate is higher than other rural counties, but our cases are higher than other counties too. How many of the people you see are out of county people that are coming in to the clinic or to the hospital sick?
Sure.
Is that a significant number or not?
Good question. I don't have specific numbers on that. I do believe, and I guess I can try to clarify some things that I can't clarify now. Rich, I'll try to collect info and maybe send back to you, and you can blast out to the group. Yeah, of those 50 cases, I believe those are 50 active cases in the county here. If somebody is a county of origin somewhere else, they typically get the case number will be assigned to their county of origin.
Right.
So that should be 50 people here who are Wallowa County residents, who are on the number. Yes, we have seen certainly positive cases from visitors, especially this summer as we've been busy with tourism. I'd say the vast majority of cases, however, and again, I don't have a specific number for you, but on our gestalt from being here is a vast majority are people who are here in the county, and residents of the county. So And I think everybody who's been hospitalized here in our hospital, I would say, I think everybody has been a resident of the county. So we've not been hospitalizing people here from outside the county, not had to do that.
Okay. Now you can't, there's a question about how many of those 50 are currently hospitalized. Also questions about deaths, and I know OHA, there's a lag time there. I don't know how much you can say about that. And the other thing that is related, you might say, I understand we don't have ventilators, so when you have to send people out, can you send them out now?
Sure. Yes. So a couple of those questions. Let's see, ventilators. Yes, we do have 5 ventilators. Those include the ventilators that are on our emergency medical, on our EMS trucks. So we have to pull those off the trucks if we want to use them. But we do have a number of ventilators. We use some of those ventilators to put people on what's called high flow nasal cannula. So this is a apparatus that delivers can deliver up to 100% oxygen. Generally, when people have like a nasal cannula in place that maybe you've seen people walk around with or whatnot, those only deliver about 15-20% oxygen. So this other device called the high flow nasal cannula actually creates a seal and can deliver 100% oxygen. It can also provide pressure support for people who are struggling to breathe. That's the preferred intervention for people with coronavirus, just based on data throughout the country from critical care ICUs. And so we've used that for a number of patients in the hospital. And that's really as a bridge to hopefully avoid intubation. We do need specialized equipment to run those. We actually use our ventilators to run those the high flow nasal cannulas. We hope that that's a bridge to preventing intubation. The second question about if we do intubate somebody, do we have somewhere to send them? Gosh, that's been really a struggle. And I would say right now it's I think we would probably not have anywhere in the region to send them, and whether or not we send them, if we really get in a bind and send people out of the region would be like to Montana or Utah. I know that's been happening at other hospitals, LeGrand in particular, but there's not an intensive care bed to be had in the Boise area. St. Alphonsus and St. Luke's are totally full. There hadn't been an intensive care bed to send anybody to in Oregon as well. And I don't think that's changed. I think, every day the numbers are a little bit different, but really the hospital systems their ICUs especially are basically totally full. So I spent a couple hours on the phone maybe 2 weeks ago with a patient who needed an intensive care bed and called 14 hospitals, and there was it was not a bed to be had. So we're really, especially for critical care and ICU beds, we are really in a tough spot.
Wow. There's let's see, local testing. So we have some of those 50, most of those 50 are quarantined at home now. Is that true?
That's correct. Yep.
Okay.
Oh yeah. Sorry, your other question was about hospital numbers. Yeah, I can't comment on how many people are hospitalized currently. And as far as also with the deaths, I would just reiterate that the numbers do lag behind on the OHA website, and would just encourage people to follow that. And while it does lag a little bit, that should be accurate information.
I did not get an Oregon Health Authority update yesterday. Did anybody else? I'm on their list. I get one every day, but I didn't get one. And I tried to Google it, and there was September 3rd was the last date. So I don't know whether they're falling behind or now. It was a holiday, yeah, but that doesn't matter. They've been.
Well, the hospital today posted on Facebook Friday's stats,
Right.
And they said that the stats from over the weekend would be available later today.
Okay. Okay. I'm trying to read through the chat box too, Dr. Maly, but also you want to comment on where you are with other procedures? Are you turning people away when they need to have their bone reset or something else done, or handling it another way? What kind of pressure are you under there?
Yep. Yeah, good question. And yeah, I am scrolling through the chat box to try to get to some of those other questions. The hospital is not currently postponing certainly any urgent surgery, and are also continuing to do elective outpatient procedures. So that doesn't mean that patients need to be admitted. So the hospital is currently continuing to do those procedures. And I think our bed status, the hospital has been on and off divert, which right now typically divert means that the number of patients exceed the hospital capacity to take care of them. Sometimes that a lot of that depends on our staffing, how many nurses we have available. I guess that's probably usually the rate limiting step. So the problem with that is that a lot of times we're on divert. If we're on divert, we typically send people to other hospitals, but right now the other hospitals are full. So we're trying. I think we're trying to accommodate as many people as possible, continuing to do surgeries that are necessary, while trying to avoid sort of admitting more patients and continuing to be able to take care of patients who are acutely ill and need to be admitted to the hospital.
Well, Kathleen has asked a couple of times, what about the healthcare business itself, the clinic, the hospital, and people who are vaccine resistant within that community? And I'll make it a little, our Josephy Center is now requiring people who work here or teach in our classes to be vaccinated. We haven't had any lawsuits yet, have we, Cheryl? Anyway, I wonder where you stand on that. Are there still people working who are unvaccinated, and what do you do about that?
Sure. Yeah, we've had, as the medical director here at Winding Waters, we've had discussions on our executive team about what to do and how to manage that. And I think we've been fortunate at our clinic that we have, I would say the vast majority of our clinic staff chose to be vaccinated before the vaccine mandate went into, or is sort of going into effect, which is won't be in effect until October 18th, but is sort of unfolding. We expect that there may be some of our clinic staff that choose to move into a different occupation rather than stay here and receive a vaccine. We have had some people who have been vaccinated recently, so we're hopeful that will continue. There are medical and religious exemptions that are specific, that were sort of structured by the Oregon Health Authority on what will qualify for a medical or a religious exemption from vaccination. So people who are qualified for those may continue to work in the healthcare profession if they do have those exemptions. I'm not sure, and also don't want to comment too much about our specific staff, but I expect that some number of people will fit that here at our clinic, as well as at the hospital, as well as other healthcare settings in Oregon. So I don't know what that number will look like. I think it'd be an exceedingly small number here at our clinic, and I think we will continue to practice, wearing a mask and using hand hygiene, et cetera, and using other safety measures that we know are effective at reducing risk of transmission from patients to staff or staff to patients as well. So I guess I don't want to comment on our vaccination rate specifically at the hospital or the clinic, and I actually don't know what the vaccination rate is at the hospital since I'm not on their administrative team. But at our clinic, we expect a very high vaccination rate. Certainly by the time the vaccine mandate goes into effect on October 18th.
So Reverend Tony Robinson wants to know what qualifies for a religious exemption.
Uh-huh.
That's
Yeah.
probably not your purview, but.
Sure. Yeah, no, that is a statement by the person who has I want to say, I don't remember the specific language, and I think it's publicly available. The Oregon Health Authority rules around vaccine mandate and religious exemption. So you should be able to find that form, a specific form on the Oregon Health Authority that I want to say has a deep-seated and lifelong objection or some, I don't say objection, but religious belief that would mean that they would not receive a vaccination. To my knowledge, this is a person-specific attestation of verification process or something like that. And I guess I'm hopeful that we're not going to be the people verifying those, but that's my understanding of how that process will work come October 18th.
Did you see the question, Dr. Maly, about if these people that are at home, are they self-monitoring? Can they pick up and go to the Safeway whenever they want?
So people that are, both in isolation, use the term isolation for people who are positive with the coronavirus and should be basically isolating at home, and then people who are on quarantine who are exposed and could develop the infection, but are in that quarantine period where they shouldn't be in contact with other people, but have either tested negative or waiting to be testing. They are should be contacted every day by our contact tracing team. That's been challenging, especially with our high case numbers recently, but should continue to get contacted daily, and should be reiterated that they should not be going into a public setting. We don't have any way to enforce that. So yes, that's a recommendation from our health department, a daily call and a ask of people, but there's not the sheriff's department, to my knowledge, is not stopping people or anything like that who may not be following those rules.
Okay. Do you want to comment on ivermectin here? There's a long question about ivermectin and also the veterinary grade of it.
Sure. Yeah, I'd love to comment on that. Let me just read through this comment. So I would say, this has been a real hot topic recently. And I think that the data, the guidelines from our, the CDC, NIH, American Medical Association, basically any group in the U.S. right now is to not use ivermectin as a treatment or prevention for coronavirus. There have been a lot of studies on its use. I would say the data is not very good as far as the quality of the studies and what they're reporting and follow-up and whatnot. So the folks called the Cochrane Review reviewed all the studies and said, there's really not enough data to say that we should. there are ongoing studies right now. The Oxford University is doing a study on ivermectin. They also did, our initial sort of anecdotal evidence of working. So, for instance, hydroxychloroquine, which is many of you may remember, or azithromycin, which is a common antibiotic. So those were used initially and tried and really then studied, and thereafter really the studies didn't pan out. So so they have added ivermectin as one of their drugs to study, and they're currently studying. So I would say that the vast majority of data is not sufficient at this point to recommend using that, and I don't recommend using that. It looks like this comment was that cheap and there are a few side effects. I think yes, it is relatively cheap. It's an old medicine, has been around for a long time. The side effects are somewhat limited, although especially in higher doses that are I guess maybe reported in some of the studies or encouraged by some of the treatment algorithms, can be certainly toxic, and the I think reported in the media elsewhere is a decent number of emergency room visits with people who have overdosed on ivermectin. Yeah, so I would discourage its use right now based on the lack of evidence, possible harm, especially at high doses.
Okay.
Can I chime in? I guess I would say for ivermectin too, the dosing is 0.2 milligrams per kilogram, and it's an anti-helminthic medicine, so it kills invertebrates in our system. And the dosing traditionally is for one dose, and if you have persistent infection, you can take another dose 7 days later, up to a max of 3 doses total in a month. And the algorithms that I've seen are, daily dosing of ivermectin, 0.4 to 0.6 milligrams per kilogram of ivermectin. So we just don't, yes, this is an old medicine and it's been used for a long time, but the doses are just and frequency of dosing are so much lower than what people are using for the treatment of COVID. And then also to know a distinction between, are we using this as treatment for COVID or prevention for COVID? And that is not a substitute for immunization. But there will be lots more to come on ivermectin when the clinical trials come out.
Thank you. Thank you.
Thanks, Annika. That's my wife, Annika, who's also a physician here at Winding Water. So yeah, so I'm scrolling through these other questions. Thanks, Annika, for putting in language for religious exemption, sincerely held religious belief.
Jump down to the school one. How should I be about my children under 12?
Sure.
In public
Yeah,
school?
gosh, had this conversation with lots of families in our community, and I think yeah, hard to answer that question. I think we're all concerned from a medical standpoint about coronavirus getting into the school and spreading in the school. Happy to see that the school boards have gone along with state mandates to have masking in school, and hopefully that will help limit coronavirus spread. I guess I'm hopeful that the schools will follow that guideline and really enforce that, along with distancing inside the school. I know I don't know all of the measures that the schools are taking as far as like rotating lunches or things like that, but I know that has been happening in the past. I think I've told parents that the risk is certainly not zero for sending your kids to school. It's unfortunately that's where we're at. I think a personal decision based on based on what what alternatives exist and what sort of risk tolerance for parents and for children. So I'm hopeful that that masking and distancing and other things that the schools are doing will help limit coronavirus spread. And as far as vaccination for children, still waiting. I don't expect that vaccinations will be authorized for children until late fall, winter time. So I think that's unfortunately going to be an ongoing issue through certainly the first half of the school year.
Somebody's asking about church services without masks, but I think that goes for any indoor activity without mask, right?
Sure. Yeah, good question. And I think really that's without a mask inside is definitely the highest risk time to potentially spread coronavirus. So I certainly want to encourage people to continue participating in their with their church if that's an important piece of their life. I think we've all been under lots of stress this last year and a half, and that can certainly be helpful for people. So I think encouraging to continue to reach out for community support, but being inside a building without a mask with a number of other people, I would say not, especially with our case numbers right now and the amount of virus in the community, would recommend against being in that situation.
Cheryl wants to know how you convince somebody. You said you're getting more people vaccinated now. So what are the seem to be the persuasive arguments for getting somebody, like losing their job or $5,000 reward? What's the deal?
Right. Yeah. If I had the answer, I guess I'd be I don't know, hero or something. But yeah, if I know various people, states and medical providers have tried lots of different things. I think anecdotally, having a conversation with people about their concerns, what specifically are they worried about with the vaccine, having that conversation with me or their doctor. I think having a trusting relationship with people where they value your opinion and they know that you're not saying this just because you're trying to, tell them what to do or mandate what they need to do with their life, but really that this is about, getting them safe and really the safety of our community. There was a comment earlier about public health and sense of partnership with people. And, I'm trying to encourage people that, gosh, vaccination is the safest way to protect you, but also to protect everybody around you, people in our community, from getting sick, and that this is, is really about all of us together. So sometimes that conversation resonates, and sometimes that doesn't. Other people, yes, they're mandated by their work, and if they don't have a medical reason they can't receive a vaccine, I'm telling them that that's.
Is it not true that most of the people that are parent age now, that have children, so the people say under 50, have no recollection of polio? When did we stop giving? I got vaccinated for smallpox as a child, and then before I went in the Peace Corps again in 1965. When did we stop vaccinating for smallpox? And do people understand that we've been vaccinating for smallpox for 200 years and we finally got rid of it? Is there just a lack of knowledge about the efficacy of say polio vaccines, smallpox vaccines?
Yeah, Rich, that's a good question. I think people are aware of that. We still vaccinate against polio. I think there was a story that there was no wild cases of polio this year in Africa. And so, yeah, big successes with vaccination. You mentioned smallpox, obviously. So, gosh, I don't know if that's part of it, that people don't see the illnesses that we vaccinate against now because of vaccines. And so therefore it's, the risk is low. I think, the coronavirus, I think, is challenging because, still the vast majority of people don't die if they get the coronavirus. And so that's, I think, probably the biggest argument that our discussion I have with people is my risk of getting sick from the virus is still low. And I always encourage them that while that may be true for them individually, especially if they're younger and healthier, the risk from vaccination is lower. The risk of basically any side effect from the vaccine is higher if you get the virus, get infected with the virus, than if you get a vaccine. And so that's part of the argument, and also that you're protecting really not just yourself, but the children in our community, the older people whose immune systems haven't been able to build a good response to the virus, or people even with breakthrough infections. So
I think anecdotally, I know people that relatives and close friends of people who have died or become severely ill still refuse the vaccine. Are most people that are in that situation going ahead and getting vaccinated? Are most the people that are relatives of those who have died or been severely ill, are most of them getting vaccinated or not?
Yeah, I guess I can't
Totally.
comment on the number, but right, anecdotally, right, sure is not everybody have people that have gotten severely ill from coronavirus and still don't want to get a vaccine after they've recovered, or who've had family members get severely ill or die. So I think some of those people do change their mind if they haven't been vaccinated already, but unfortunately some people still choose not to get vaccinated.
Yeah.
Let's see, a couple more questions. What extent are you not able to treat patients to what extent are you not able to treat people who do not have COVID? Okay, I think that was around, we've still been able to treat everybody at this point. And let's see, the death rate is lagging. Yeah, gosh. And the death rate can lag quite a while. That is true. Yes, I don't know that I'm authorized to discuss our sort of current death rate, unfortunately.
We have a couple of retired medical people who want to know how you can have how medical personnel who are not getting vaccinated talk to patients.
Sure. I think that's a challenge. Yep, I think if medical personnel aren't getting vaccinated, I think they're probably not going to be the ones convincing folks to get vaccinated or patients to get vaccinated. So I think, yes, that's I think that's a challenge. So I think we're trying to, from my standpoint and our provider standpoint here, just trying to provide good information about the vaccines, encourage that everybody should get vaccinated, and that's about, I think, the what we can do right now. So,
okay. Cheryl wants to know about the new variants. Are we on the? We start to hear a little bit about them. Are you keeping track of variants of the patients you have?
Sure. Yeah, we haven't been testing everybody. It requires a separate test for which strain of the virus you have or which variant. So we had been collecting information on all of our breakthrough cases. So if you had a breakthrough case, you're fully vaccinated, had an infection, we were sending those off for genetic sequencing at the state to look at what strain of the virus. The state doesn't have capacity to do that on everybody who's diagnosed. So that was sort of why we were choosing that population in general. The state does keep tabs on percentage of variants. I think we're at like 3/4 Delta virus, at least on our last look. That was, I want to say, last week or 2 weeks ago, and I looked at that, and I expect that to be higher. So I think we presume that almost everybody is getting infected right now is with the Delta variant.
Okay. Is there fear in the medical community that this variant is not the last and that something else is going to come along? Yeah,
I think that would be the expectation. The fear and the expectation is that yes, we'll have continuing variants as we have, continue to struggle to get everybody vaccinated. The virus will continue to circulate, and we'll continue to sort of have variants. The virus is continuing to sort of adapt to the conditions, and so we're certainly concerned that a new variant may leave our current vaccine less effective. We don't know that that's going to happen, but that's definitely a concern. So currently the vaccines have been performing against the Delta variant. There obviously, like I said, have been breakthrough cases, but yeah, that's definitely a big concern.
Thank you. Okay, anybody else out there? We've got about 5 minutes left. Or do you, or does your wife have a wrap up? She want to kick in there, or either of you have a wrap up?
Yeah, hopefully. She's keeping me honest there. Hopefully I'm not, or hopefully I'm providing all accurate information.
I don't want to provide the closing statement, but I guess just to follow up on the question about medical personnel who are not vaccinated. So clinics and the hospital, we can't disclose the employee's immunization status. But if that is something that is important to an individual, that is a question that a person can ask. And the employee can choose to answer that however they like, but you do have that right as an individual to ask if the person taking care of you is immunized or not.
Okay.
We'll
Does that
say,
help, Angie Lundy?
and we'll say all of our providers at Winding Waters are vaccinated. That's it, and that would be all of our primary medical providers, physicians, physician assistants. So
Good.
They've self-disclosed that information. So question from Don quick, looks like I got the J&J vaccine. Should I be more concerned than some of the mRNA vaccine? Yeah, Don, good question. I think that the mRNA vaccines have performed a little bit better, although the data is still questionable. But I think those have performed a little bit better than the Johnson & Johnson vaccine. That said, the Johnson & Johnson vaccine still has proved to really good at preventing hospitalization and death from the coronavirus, which is really our primary outcome that everyone's most concerned about. Maybe a little bit less effective at preventing symptomatic infection or asymptomatic infection, breakthrough infection. So I think I'm hopeful. Johnson & Johnson is looking at a booster dose at some point. I think they're still working on what the time frame would be and what and whatnot, and still working with the FDA to get that emergency use authorization. So and right now for booster doses, when they do come, we are currently recommending people receive the same vaccine that they received previously. So if you received a Moderna vaccine, it'd be a Moderna vaccine. Johnson & Johnson, you receive a Johnson & Johnson booster. But I wouldn't recommend any particular precautions to be taken if you've had a Johnson & Johnson vaccine compared to mRNA vaccine. We're really, I think, encouraging the same precautions for everybody.
Well, I want to thank you very much, Dr. Maly. I think you've answered a lot of questions that are roaming around the county here, and we're going to follow this up, folks, with a session. I hope we have a session with the hospital, not just about coronavirus, but talking about the relationship between the hospital and the wellness center and the clinics, and the new clinic in Wallowa and the new clinic in Joseph, and how that healthcare system all fits together. And I'm also, she doesn't know it yet, but Don, I'm going to ask Karen Patton to give us an update on the schools and what they're doing about masking, about vaccinations among their staff and all of that. This is one of our primary concerns right now, and we thank you in the medical field for doing the good work you're doing. Okay.
Yeah, thanks so much, Rich, for having me on. Thanks everybody for calling in. And yeah, I think as we've sent emails out to our staff when everyone's burned out and whatnot, that we're all here to take care of each other and get through this together, however long this is going to go on for. But yeah, so thanks so much for having me on.
And the next,
we would like to do a follow-up.
well, yeah, well, she's already talking about follow-up, but I'm talking about, you can put your mask on because you have to have your mask to get into the Josephy Center, but you've got a $25 gift certificate in our gift shop.
All right. Thank you very much. Yeah, my pleasure. And thank you all for again, for listening to me. So I appreciate it.
Okay. And thank you all for attending. Okay. Well, he did a good job. Don't you think?